Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about some changes to HIPAA in 2024. Some of these are proposed still and may not take effect until 2025. And then we have another one I want to discuss that does take place on December 23rd, 2024, which is coming up rapidly. So I just want to talk about this. I haven't done a HIPAA video in a while, so I just wanted to discuss it. I will be putting links of what I'm discussing in the video description for you to click and read a little bit more on it. Again, as always, my videos are not full content. It's not all the details. It's just the high level points. So I want to encourage you, as always, to go do your own due diligence, do your own research, and do your own reading to learn more. This is just to spark interest. So I have some notes from this. And so apparently, the last major update to HIPAA hasn't been since 2013. And that's actually when the High Tech Act, when it became effective. There we go. And the HHS, which is the Health and Human Services, and the OCR, the Office of Civil Rights, which work together for HIPAA privacy and security details, they issued a notice of proposed rulemaking in 2020 because it takes that long to develop these new policies and review them and propose them to people and ask for their feedback before they actually implement them. And so they're most likely to be published in 2025, but like I said, there is going to be one that I'm going to discuss briefly that does go into effect December 23rd, 2024. The biggest one that's going to most likely go into effect in 2025, which parts of it are already or were already kind of being used because of the CARES Act from the pandemic, involves the substance use disorder situation. So I'm not sure if any of you guys are aware, but for release of information, you have to have a separate release of information to give to people for substance use disorder information and mental health information. It can't be blanketed into your standard release of information for medical records. And that's because right now, all your medical records, minus substance use disorders, AIDS and HIV, STD information, mental health stuff, is all governed under HIPAA. And so you have one specific release of information that your patients can fill out, and that is good for basic all medical information except for what I mentioned. And then you have the substance use disorders, mental health, specifically what I'm talking about today, and that actually follows under the substance use disorder specifications and regulations. So that's why they need kind of an extra or additional authorization to release those separate than medical records. And if you've ever paid attention to true, real, good, let's say authentic release of information forms, you'll see that it requires like additional signatures or initials for specific items such as HIV and AIDS information, STI information, mental health, and substance use disorders. That's because they're governed separately. And so this proposed rule would actually help them bring the substance use disorders and mental health into HIPAA so it can be governed under that one release of information, because then it will help with coordination of care for these patients. And it will allow them and their providers who are across disciplines or in different areas, whether it's like an inpatient, outpatient type rehab versus their primary care versus maybe a pain specialist, to be able to see all that information. Because right now, with kind of that wall there, it's kind of hindering this whole treatment of the opioid epidemic, because when practitioners aren't able to see that information about their substance use disorders, they might inadvertently prescribe them pain pills and they shouldn't, right? Because of their history of drug abuse. Or they might be giving them something that would not help their sobriety or it would hinder their sobriety. So that would give a little bit better insight to providers when they're treating these patients to do it to the best of their ability, knowing about all of that so they don't set them up for failure. So the new rule was proposed in 2024, like fully, and they're hoping that it will be published in 2025, and that the compliance for it will all have to be into effect by February 16th of 2026. So it will be better for broadly treating patients, for payments of patients, operations, covered entities, and BAAs will now also be able to receive that data when they move it under HIPAA, because right now, again, it needs that separate ROI. So if you don't have it, it can't be forwarded to your covered entities to help. It can't be forwarded to your business associates, and it makes it really difficult. So this would make it a lot more simple. There would be additional guidelines, like they wouldn't be able to be used in certain court or legal situations, the records without additional authorization, stuff like that. There would be additional guidelines for it in HIPAA, but it wouldn't be separate like it is now. So I think that is really good, because I do know of a lot of patients personally that they have made the decision to make sure that they're not prescribed any opioid medications when they're sober. But then I know other patients that, because they were like, oh, well, they're prescribing it to me, it must be okay. And it's caused some bad rebound issues because they didn't think about themselves and how their body reacts. They're just thinking that because a provider says it's okay, that it's safe. And it's really sad, but it's just the way our minds work, right? So, again, I think this will be really good. The one that I want to talk about that goes into effect December 23rd of this year, 2024, is a privacy rule. So it's a HIPAA privacy rule, and it's strengthening reproductive health care privacy. And I encourage you to read the details of this in the link that I'm going to be providing. But it's one of those things that is going to help with some of the birth control, abortion, miscarriage, anything related to reproductive medicine. It's going to possibly restrict records from going across state lines because of certain legislature and state stuff. And it gets kind of political and it gets really convoluted. So I'm not going to talk about that. I just encourage you to read about it if that's something that might affect you as well. But right now it's going to be strengthening that. There is a possibility it could get reversed with the new administration coming in, but they're not sure about that. So, as far as everything goes right now, it does go into effect December 23rd, 24. So, I would read up on it and be aware of it. The other proposed rule is a security rule, and it actually was proposed back when Trump was in administration the first time. It just takes a while, like I said, to get this stuff up and going, but it's a cybersecurity requirement for HIPAA regulated entities. And this is because of all the growing technology and everything that's stored in the cloud and all of that. And so they could be changed again, of course, but it's one of those things that I think is very much needed with the cybersecurity. I mean, we saw the Change Healthcare hack in February of this year. Sorry, we're not in the new year yet. February 2024, Optum's Change Healthcare got hacked, ransomed. That has still caused ripple effects with a lot of practices that are still trying to get caught up and still feeling the effects of it. I mean, it was really, really bad. And so I wouldn't be surprised, since this is proposed and it's not final yet, that they're going to implement even stricter guidelines and requirements, penalties, etc., because this is very, very concerning. And so, yes, that's a security rule that's proposed that's going to be coming for cybersecurity, which I think is very warranted after having to help people and hearing the horror stories and the sad stories of how they were affected by Change Healthcare's issue earlier this year. Again, there's a lot more out there, but these are kind of the big takeaways. Again, Nothing big has been revised with HIPAA since 2013, so they know that there needs to be some changes with the changes in our technology with AI, the way we store stuff, the way we communicate. So, anyway, just be on the lookout for that. Also, as a reminder, don't forget to make sure that all your staff have their HIPAA privacy and security trainings every year. You have to do the training within so many days of new hires for them, and then annually after that. So, all your staff should have annual HIPAA. It should be documented somewhere. It should show how they were trained, what information they have, because if something big were to happen, you have to show that. And you don't want to skimp on this, I promise, because the fines, the penalties are not worth it. If you have any questions or comments about that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. Be well, and we will see you next time. Bye-bye.